my name is Dr. Parissis and welcome to another video. Unfortunately, I am seeing more and more repair cases from patients that went to other hair transplant clinics, were not happy with their results and come to us for a repair. Avoid these pitfalls to make sure you are not one of those patients. The first mistake that people make when choosing a hair transplant surgeon is that they don't go for a surgeon with a good skill set. And you might wonder, how do I work out whether they do have a good skill set? Well, apart from their results, I want you to focus on how frequently they're actually operating. Are they doing one case a month or are they doing 5 cases a week? There's a big difference, because if the surgeon is doing 5 cases a week, then that suggests they're keeping up with their skills. If the surgeon is doing 1 case a month, it's possible that their skills are reducing between cases. You can actually get de-skilled or de-trained, and it's important to look at how often or how many cases the surgeon is performing every week when choosing the right hair transplant surgeon for you. The other mistake that patients make is that they choose a surgeon that does not offer both FUT and FUE surgery. These are 2 different techniques of harvesting the donor area, taking grafts from the back and sides of the head in order to put into the top, the recipient area. They are different techniques and they benefit or are appropriate for different patient situations. And so avoid doctors that are not offering both, because they could give you the wrong advice to get the surgery that they offer when it might not be the right surgery option for you. Another pitfall that patients make is that they focus too much on whether the surgeon that they're getting their hair transplant from is a member of organizations like the ISHRS or the American Board of Hair Restoration Surgery. How I see these organizations, and Dr. Bloxham I know would agree with me, is that they are evidence that you won't pay your deposit, turn up to the clinic, and the clinic doesn't exist. So they are evidence of trustworthiness in that way, but they do not suggest that you're going to get a good result. This only depends on the skill of the surgeon. And so really, in summary, I would use these organizations to ensure that you're not getting surgery off a guy off the street, but also take it with a pinch of salt. Don't go for the surgeon that has all the membership to all the organizations, because it doesn't necessarily mean you'll be happy with your end result, really. Another mistake is that patients go for a clinic that promises the maximum number of grafts. And you see so many of these clinics popping up, especially in countries like Turkey, promising large numbers of grafts harvested from, usually by FUE, and decimating the donor area. And the result of that is that we use up all your donor area so that you don't have any to use in the future. So it means that if your hair loss progresses, which it likely will, because that's how hair loss works, that you won't have any more in the tank to work with. And so it's super important that your hair transplant surgeon is treating the whole hair loss journey and not just your situation right now, not just putting a patch over a wound. They are looking at you and your whole sort of journey, doing what's best for you at that particular moment in time, even if that means using perhaps fewer grafts now so that we save more for the future. Really treating hair loss as a game of chess is the best way. We're kind of shooting at a moving target. Hair loss happens, we might do a hair transplant to fill in the gap, and then hair loss progresses again and we kind of fill in that gap. And so it's really shooting at a moving target in that way. And I do want to say one thing, that if your hair transplant surgeon is not willing to talk about medications, this is often a very telltale sign of someone who's not considering your whole hair loss journey. A hair transplant surgeon should be very up to date with all of the recent medications and pharmacological options. This is really to make a balanced and informed decision about your surgical management. Another mistake that I've seen patients do is that they do not ask about the technicians, and specifically what part of the surgery are the technicians doing. In summary, technicians should only clean and handle grafts. They should not be making any of the cuts or incisions to the skin. There should be no knife to skin from the technicians, if that makes sense. So that means that all the harvesting of the donor area, all the making of the recipient sites or the slits for the actual follicles to slip into, all of those should be done by the surgeon. If you're going to a hair transplant clinic that is sort of shady about what part of the procedure the technicians are doing, or the technicians are doing the incisions and cuts, well then you know to avoid that place, because they're not medically trained, they don't understand how skin laxity, how the anatomy of the scalp actually works, and so your result might be compromised. I'm absolutely fine with my technicians, for example, handling, cleaning, dissecting grafts after they have been harvested, and also inserting the grafts into recipient sites when they are skilled enough. But for you, moving forward, I would always ask, what part of the procedure are the technicians doing, and be really clear about it. The other thing that I've seen people focus on is latest technologies or latest techniques. And this is a very deceiving thing to hear. When you think about a surgeon or a clinic that is using the latest technologies or latest techniques, well, every hair transplant clinic should be using the latest technologies and latest techniques. This is not something that is kind of a big deal. It shouldn't be a selling point for you. I would expect my hair transplant surgeon to be using the cutting edge tools, state-of-the-art microscopes. Everything should really be as good as it can be. And really there's no technology or technique that replaces the surgeon's skill. That's really what you need to be looking at. And this really brings us on to results, results, results. I've seen patients not focusing on the results enough. A lot of people forget that the quality of the results, or how dramatic the transformations may be, is one thing, but they forget about a key part of any surgeon's results, and that is consistency. Is the surgeon getting one good transformation a year? Are they compiling those together and making a results page? Or are they getting good results day in, day out? What does the average result look like for that surgeon? The best way to work out how consistent someone's good results are is to try and find lots of good results. It shouldn't just be one or two results that look pretty good. It should be many results that look good. And B, actually ask the surgeon directly, what can I expect? What kind of result can I expect from this procedure? What is the average result that you would expect, and what would be above average? And get the surgeon to go through some images to really understand what kind of level of results that surgeon is delivering. In summary, as Dr. Karadeniz from Turkey says very well, there is no new technology, no technique, no marketing tool that is going to replace the surgeon's skill. And the surgeon's skill is mostly going to depend on the surgeon's passion for what they are doing. I love the analogy that Dr. Karadeniz uses. Just like a good cup of coffee, a good hair transplant requires love to get good results. And this, as a potential patient, is something you can only get a feel for yourself. Thank you guys for watching.